Nasogastric tubes, often referred to as NG tubes, are thin, flexible tubes that play a crucial role in modern medicine. These tubes are carefully inserted through the nasal passage, passing down the esophagus, and ultimately resting in the stomach. While seemingly simple, NG tubes serve as a vital lifeline for patients who are unable to eat, drink, or manage their digestive systems independently. Imagine a patient who has undergone major surgery and is temporarily unable to swallow. In this scenario, an NG tube becomes their lifeline, delivering nourishment and medication directly to their stomach. This allows their digestive system to rest and recover while ensuring they receive the necessary calories and nutrients for healing. They also play a critical role in managing medical conditions that affect the digestive system. For instance, in cases of intestinal obstruction, an NG tube can help decompress the stomach, relieving pressure and discomfort. In essence, NG tubes are versatile tools that embody the ingenuity of modern medicine. The human body is a complex and interconnected system, and when one part malfunctions, it can have ripple effects throughout. NG tubes step in as a critical intervention for a variety of medical conditions, providing support and relief when the body needs it most. One of the most common reasons for NG tube placement is dysphagia, a condition that makes swallowing difficult or even impossible. This can arise from a variety of causes, including stroke, neurological disorders, or physical obstructions in the throat or esophagus. For these patients, an NG tube becomes a lifeline for receiving essential nutrition and hydration. Beyond dysphagia, NG tubes are instrumental in managing gastrointestinal bleeding. In cases of ulcers or other bleeding lesions in the stomach or esophagus, an NG tube can be used to both identify the source of the bleed and deliver medications that help stop it. Another critical application of NG tubes is in cases of bowel obstruction. NG tubes provide a way to decompress the stomach, relieving pressure and allowing the intestines to rest and potentially heal. Just as a carpenter relies on various tools for specific tasks, medical professionals have a range of NG tubes at their disposal. The Levin tube, a single lumen tube made of polyurethane or silicone, is one of the most commonly used types of NG tubes. Its simplicity and versatility make it suitable for a wide range of applications, from delivering medications and fluids to removing gastric contents. For situations requiring continuous or intermittent suction, the Salem Sump tube is often preferred. This double lumen tube features a main lumen for drainage and a smaller vent lumen that allows air to enter the stomach, preventing the tube from adhering to the stomach lining. In addition to these standard NG tubes, specialized tubes like the Dobhoff tube cater to specific patient needs. The Dobhoff tube, a smaller bore tube designed for long-term feeding, is inserted through the nose and guided into the small intestine. The process of inserting an NG tube, while routine in a medical setting, requires careful preparation and a gentle touch. Healthcare providers follow a standardized procedure, prioritizing patient safety and well-being throughout the process. Before the procedure, the patient receives a thorough explanation of the process, addressing any questions or concerns they may have. The patient's nasal passages are then carefully examined to select the most appropriate nostril for insertion. Once the nostril is selected, a topical anesthetic is applied to numb the area and reduce discomfort during insertion. The NG tube, measured and lubricated for ease of passage, is then gently advanced through the nasal passage, following the natural curvature of the throat and down into the stomach. Section 5. Ensuring accurate placement verification techniques for NG tubes. Accurate placement of an NG tube is paramount to its effectiveness and the safety of the patient. The gold standard for confirming NG tube placement is radiographic examination, typically an X-ray. This imaging technique provides a clear visual of the tube's trajectory, allowing healthcare providers to confirm its location within the stomach. While X-ray confirmation is the most reliable method, it is not always immediately available, especially in emergency situations. In such cases, alternative methods for verifying placement are employed. One common technique involves aspirating a small amount of gastric contents through the tube using a syringe. The aspirate is then tested for its pH level using a pH indicator strip. Gastric fluid typically has a pH of 5.5 or lower, so an acidic pH reading provides reassurance that the tube is correctly positioned in the stomach. Section 6. Weighing the benefits and risks, indications and contraindications. The decision to place an NG tube involves carefully weighing the potential benefits against the inherent risks. The indications for NG tube placement are diverse, encompassing a range of conditions that affect the digestive system and beyond. In cases of impaired swallowing, NG tubes provide a lifeline for delivering essential nutrition and hydration. Beyond nutritional support, NG tubes play a crucial role in managing gastrointestinal bleeding. While NG tubes offer numerous benefits, their use is not without risks. Contraindications, such as severe facial trauma or recent nasal surgery, must be carefully considered. Section 7. Navigating potential complications. Recognizing and managing challenges. While NG tubes are generally safe and well tolerated, their use carries a potential for complications. One of the most common complications associated with NG tubes is discomfort. The tube's presence in the nasal passage and throat can cause irritation, leading to a sore throat or nasal congestion. Another potential complication is aspiration, which occurs when gastric contents or other substances enter the airway. To minimize the risk of aspiration, patients with NG tubes are typically positioned with their heads elevated. Tube dislodgement, particularly in patients who are restless or confused, can lead to the tube entering the airway or other unintended locations. Regularly checking the tube's placement and securing it properly can help prevent dislodgement. Section 8. Maintaining the lifeline, care, and maintenance of NG tubes. Once an NG tube is in place, proper care and maintenance are essential for ensuring its continued functionality. Regular flushing of the NG tube is crucial for preventing blockages and ensuring the free flow of fluids and medications. This involves using a syringe to instill a prescribed amount of sterile water or saline solution through the tube. Maintaining the cleanliness of the area around the tube's insertion site is paramount for preventing infection. The skin around the nostril should be gently cleansed with mild soap and water at least once a day. In addition to regular flushing and hygiene, careful monitoring of the tube's placement and the patient's response to therapy is essential. Any signs of complications should be reported to a healthcare professional immediately. Section 9. The path to removal criteria and procedures for NG tube removal. The decision to remove an NG tube is made once the tube has served its purpose and the patient's clinical condition allows for its safe removal. This decision is made in consultation with the healthcare team. Before removing the NG tube, the patient receives a clear explanation of the procedure. The patient is then positioned comfortably, typically in a sitting or semi-reclining position. The healthcare provider first deflates any balloon, if present, and then gently advances the tube slightly to disengage it from the stomach lining. The tube is then carefully withdrawn using a slow and steady motion, while the patient is instructed to hold their breath. Once the tube is removed, the area around the insertion site is inspected for any signs of bleeding or irritation. The patient is monitored for any adverse reactions, such as nausea or difficulty breathing. Section 10. Special considerations. Tailoring NG tube care to diverse patients. While the fundamental principles of NG tube care remain consistent, certain patient populations require special considerations. Elderly patients, often grappling with age-related physiological changes, require a heightened level of care and attention. Cognitive impairment, common among older adults, may pose challenges in communicating discomfort or understanding care instructions. Pediatric patients, with their smaller anatomies and developmental stages, present unique challenges in NG tube management. Selecting the appropriate tube size is crucial for ensuring a proper fit and minimizing the risk of complications. Patients with underlying respiratory conditions require careful monitoring during NG tube placement and removal. Section 11. Real-world applications. NG tubes in emergency and critical care. The versatility and life-saving potential of NG tubes are perhaps most evident in emergency and critical care settings. Imagine a patient rushed to the emergency room after a motor vehicle accident, suffering from multiple injuries. In this scenario, an NG tube becomes a lifeline, providing a means to decompress the stomach and allowing for the safe administration of medications and fluids. In intensive care units, NG tubes are routinely used to provide nutritional support to critically ill patients who are unable to eat or drink on their own. These patients require a constant supply of calories and nutrients to support their body's healing processes. NG tubes offer a safe and effective way to deliver these essential nutrients directly to the digestive system. In cases of drug overdose, NG tubes provide a means to administer activated charcoal, preventing toxins from being absorbed into the bloodstream.